Distribution is a completely different animal than what you think of when you think of healthcare. In supply chain, there's an opportunity for us to be the behind-the-scenes team for our caregivers, right? Our physicians and our nurses. We are the lifeblood of the organization, and a lot of people don't realize how much we do in order to keep those patient-facing areas functioning. Wellstar Health is a large health system here in Georgia, comprising of 9 hospital facilities, 5 health parks, and over 350 physician offices. Our mission is people care, taking care of the community, because at the end of the day, we are members of that community.
The healthcare industry has adopted a CSC, or Consolidated Service Center model, over the past decade, which is an off-site warehouse and distribution center. Wellstar entered this as we built out their Texas Elite warehouse management system to operate and to streamline the growth within their CSC.
With the manual processes that were in place from the transition from our former facility into this new one, we realized that there was no way we could keep up with the growth of the community, and automation and optimization of our operation is ultimately the conclusion we came to. Aside from forklift trucks, there wasn't any kind of automation or even motorized solutions here at the facility. Anything we could do to utilize conveyance to minimize travel of people and maximize travel of product, we could absolutely save time and funds to improve our throughput.
When you make a small change, but it actually has a large impact on the team, then you can see how that has a ripple effect towards other changes that need to be made. And I'm hoping that the process improvements that I do here will have a ripple effect into the hospitals and the sites that we support.
With Texas Elite WMS, we are able to be the go-between from the automation to the supply chain solution. So we're able to facilitate orders, facilitate picking into the automation process. Wellstar has adopted automation within their warehouse, within their CSC, and they have seen extreme growth, extreme success, and gained efficiency out of that.
We've found 220% increase in our productivity. We've reduced the cost per pick by 30% and believe with the new inbound solution and case picking solutions that we can increase that reduction even further. We are over 99% on our daily fill rate, which includes orders to our clinicians. And we've seen a 35% reduction in our pick-pack time, which leads to more on-time deliveries and satisfaction from the hospitals. With the inbound delivery software that we implemented, we are working on something that we believe is leading edge, and it essentially gives us better visibility into the chain of custody process of a product when it gets to our facility, all the way through the point in which it leaves our facility and heads to its destination. There's other areas where we've found optimizing the Texas software through storage rules, routed receiving, and tools such as secondary or blind receiving give us more efficient receiving processes, better inventory accuracy, and optimizing our storage much more efficiently.
One of the things that's been a huge help is understanding the personalizations that are available in Texas, different ways to set up the data and the screens that I need to look at and how to set them up so that they are meaningful for me and what I need to do has been an eye-opener that has helped me be successful in helping to troubleshoot invoice issues or what next step needs to occur to get a purchase order completed.
The picking, packing, and shipping side of the operation also needed to be analyzed to determine where we could be more efficient. We recognized the need for automation in the form of the pick modules, which took what was previously a gravity-fed conveyance with our team members moving up and down that. They were doing 30, 35 lines an hour, and we've increased that to over 80 lines an hour, depending on which area they're working in. that efficiency is the only reason we've been able to keep pace with Wellstar's growth. So as much as we partner with Texas to stay on the forefront of automation and determine what the best solutions are going to be for us, we also really lean on other Texas users. The Texas User Group is an incredible resource that we have because healthcare is unlike a lot of other industries where we have the ability to be collaborative without being competitive.
Much like Wellstar, the healthcare industry in general and in the supply chain are adopting a new level of automation like we've never seen before. Everything from mobile handhelds, mobile computers, to robots picking in the warehouse. So bringing a solution like the Texas Elite Warehouse Management System into an organization like Wellstar bridges the gap between the solution and the automation to gain efficiency and to grow that complexity within an organization.